Hello, Andrew Colsky here with Stop My OCD and AnxietyEnders.com. And today we have a guest, Kristina Raines, PsyD. Kristina works with a lot of different things, but a lot of anxiety disorders as well. And she's going to share with us some of her experiences. So, Kristina, can you introduce yourself to the audience?
Yes, thank you, Andrew. I'm Kristina Raines. I'm a clinical psychologist. I'm licensed in California, as well as Virginia, and I'm a board-certified expert in traumatic stress with an emphasis on not only domestic violence, but anxiety and depression, as well as rape trauma and sexual assault and abuse. So I've worked with also people in EAPs and relocation and even people in the military. But mainly my focus is on EMDR. I use EMDR as well as cognitive behavioral therapies to help people with a lot of anxiety and depression and childhood trauma.
Wow. I mean, I feel very lucky to have you on because you have such a breadth of experience here. And so many of the things that you do are related to some of the questions that I get from people who want to learn more about things. So I'm hoping to talk more in a minute about EMDR, to talk more about your experience with the sexual predators and things related to that category. All of those areas I really would like to explore further. So let me just start off by, tell us a little bit about your personal background. How did you end up getting into this field in the first place?
I wanted to be a psychologist since I was 7 years old. So it was an obsession for me. My uncle, who died a few years ago, his name was Dr. Milton Gervitz, and he was chief of staff of the Department of Psychiatry at NYU for about 37 years. And we were living in California, and we drove across the country to New York to meet our relatives. And I met my uncle, and I announced that I wanted to be a psychologist like he was. And he said, then you definitely will be one. And I, through the trajectory of it, I had my own issues. I dropped out of high school. I did not earn a GED. And I didn't stop me. I didn't care what I had to do. This was an obsession. So I finally achieved this, and it was really a pleasure because I believe that since this is all I wanted to be it. I just didn't just want to do it, Andrew. So
right. So it's interesting though. You knew that before you met your uncle. So were your parents involved in the field, or how did you even know it was a field?
No. They weren't involved in the field at all. They were not introspective individuals.
Mm-hmm.
But I was just insatiably curious about people and cultures and everything. And before I was born, my parents lived all over the world. I've lived in 14 countries myself, not with my parents. I was not an army brat. This is all me. So I left home when I was 18 on my 18th birthday, availed myself the gift of liberation, and that's it. Said goodbye in a half a dozen different languages, and that's it. But my parents, they weren't involved in psychology, but they were very happy that I wanted that I had a profession in mind, and that they were supportive of it.
Mm-hmm.
So,
wow, it's wonderful. You were driven, and here you are. So that's
you.
great. So when you sort of walked across that stage and you got your doctorate degree and you were ready to go out into the world of practice, how did you start? Was there a certain area that you focused on when you first got started?
Yes, well, during my internship, I earned several board certifications, mainly in domestic violence. So they were all in the realms of domestic violence and sexual assault and abuse. So I went out with the domestic assault response team, the DART team, and then the sexual assault response team and the children assault response team. And I worked with a lot of rape victims to empower them to stand trial against their accuser. Because you have to stand trial. Well, you're a lawyer, you know this, Andrew. You got to be able to testify. So I worked with them, and then I was certified in EMDR. And then I earned multiple board certifications. I think that's very valuable. And then a generic field, you can be a general psychologist, but I think that specializing in something is very valuable too.
Mm-hmm.
That's what I started doing with in the nascent stages of my career. And then from that, I parlayed that into, I started working a lot with depression, clinical depression, not suicidal, but clinical. And also not only that, but anxiety disorders. There's anxiety. I mean, as you may know, anxiety is from the Latin anxiety, to strangle or to suffocate. And that's how people feel when they're anxious. And mainly anxiety like that is predicated on a fear of the future. They're afraid of what's going to happen. They're afraid of the unknown.
Mm-hmm.
And depression is usually a manifestation of what's happened in the past that we can't control and wish we could change it.
Right, right. Well, you said an interesting thing when you were first talking about how you started off after your degree, and I just wanted to share with you. So it was really interesting to me because when I got my first degree, it was my law degree. And as part of, well, after I got my law degree, I then went back for a master's in law. We call it an LLM. And in
Okay.
that particular program, I worked as a prosecutor. This was in Georgia. And one of the areas that I worked was we had women who were battered women. The prosecution would be for the person who did the battering, right? And one of the challenges we had, and it was relatively common, was you would have a situation, you'd have some domestic violence. Typically, the woman would get battered by the man. And by time the thing came to trial, the woman would back down and say, no, I don't want to prosecute. No, I love him. I don't want him to go to jail, even though a month ago or 2 months ago, whatever it was, he beat her up and put her in the hospital. Did you deal with those types of cases?
All the time. So, and evaluating too, these batterers too are mainly a lot of really not only pathological, but malevolent narcissists. And I mean, really malevolent, toxic narcissism. But yes, I did try to manage that. There's not a lot you can really do because they are so horrifically abused that they truly believe that they're not worthy of anybody better or anything better. And it's really inculcated into them that they are. And many of these women too, and I've worked with a lot of abused men. And it's hard for people to believe that because usually men are bigger and stronger. And one of the biggest problems I've had in my practice too is men will say, if I lay a hand on her, she'll be in 300 pieces and then I'll be serving life sentences for defending myself.
Right.
So then there's hardly really any resources for men.
Yeah.
Well, so
it's really interesting because I didn't most of the work that I do in terms of these podcasts and all is related to OCD and some generalized anxiety issues. I've never really gotten into the sexual violence or related, but as you mentioned this, that I can think back to several clients that I have had in my own practice who were subjected to a narcissist, and the client felt they had no value. The client felt they had no control. And through the work that we did, when they started to recognize their own value, when they started to feel a sense of control, to watch them blossom into a totally different person so that they're now self-assured, they're competent, they're capable, they're proud. It's amazing to see the difference.
It is, and it really is. It's as if when they start to understand the value of their own self-worth. It's like watching a flower bloom.
Right.
Yes.
So it's amazing. So I know that with this discussion, the discussion of trauma is an important piece for patients and for the work that you do. And so you also said that you practice EMDR. So can you tell us what types of traumatic issues do you typically deal with? And then tell us, what is EMDR? How did you learn about it and how do you use it?
Well, I don't use it so much anymore, but I was using it a lot in the past in my private practice. It's for trauma, traumatic memories, traumatic stress. So usually what happens, it's eye movement desensitization on EMDR.org. And it's basically the only method that's been proven to work in clinical trials. It was developed by Dr. Francis Shapiro.
Mhm.
It was movement back and forth, eye movement back and forth. And it's really does reprogram the epicenter of the traumatic experiences. So when I did use it, I used it a lot for domestic violence, not only violence victims, but people with traumatic childhoods, and even vicarious trauma. Somebody who was in a car accident or witnessed a car accident, and I've had children of Holocaust survivors in my practice.
Wow.
Well, that's traumatic. That's traumatic stress too, because they're
Mhm.
growing up with people. I mean, that they're like they're still in a bomb shelter. The house is always dark. The doors are always locked. And so I've had children of Holocaust survivors in my practice too. So that's who I really treat too. People who are victims of malevolent narcissists. That emotional abuse is terrible as well. And childhood trauma, emotional as well as physical.
Mhm.
But it's really what I specialize in for the duration of my career.
So in addition to the people who are sort of on the receiving end of the narcissism, let's call it that, have you ever had the opportunity or reason to treat the narcissist?
It can be challenging, but it's like anything else, Andrew. They have to be able to evaluate themselves to the point to realize that they have the problem and the problem is them. Now, if I'm looking at somebody and trying to discuss this, I can't sledgehammer that into them. They're
Right.
the source of the problem. And I, like I said, I don't treat couples. I only treat individuals.
Mhm.
Individuals. So, but if I'm talking to somebody, they're in a relationship with somebody, and they've endured a relationship where they've just been emotionally abused, physically even, but emotionally, even sexually abused, and they have to realize too that at some point they're the problem because they won't leave. And sometimes they can't. There's economic reasons. They have children to consider. Where are they
Mhm.
going to go?
Mhm.
They can't
Yeah.
just, and so that's what people don't understand is where are they going to go? They have no money. Most of them, there's a lot of financial abuse involved.
Right. Well,
Whoever
I
sets the
mean,
goal makes the rules.
yeah, no, it's really, I'm glad that you point that out because that is so important because it's so easy to say, well, why don't they just leave? And they
Why
don't,
don't they just
people
leave?
don't think
Yeah.
through what you just said.
Exactly. I've even had clinicians say that. Why don't they leave? Why don't they leave? And my response is, I'm very happy that you're asking me that question, because I'll never refer somebody to you. If you can't understand that and you're not sensitive enough, why would I send people to you?
Right. Right.
So this is something that, and also if somebody's abused even physically, what happens is even a restraining order, these abusers will walk right through it.
Mm-hmm.
Really, the only thing that will happen that can even really physically prevent them is incarceration.
Yeah. Well, the whole concept there about, I call it, when you're treating someone from a mental health perspective, I personally don't see how you could treat a piece of someone. You have to treat the whole picture. And the whole picture is what you're describing. It's not just, you have people who maybe want to leave the situation, but like you said, they can't for all these various reasons. And to me, it's like part of any treatment that I'm going to do with anybody has to take all of that into consideration because that's the person's real life. That's their real circumstance. It's the whole person. You can't just treat one piece and assume all the rest will work itself out. The person still has to deal with that.
Yes, they do have to deal with that. And then there's also the ramifications of children involved.
Mm-hmm.
Custody issues. I mean, you know this. I'm sure you realize this as a lawyer also, that the custody issues, and sometimes it's just easier to manage to just stay in the relationship and remain in an emotionally abusive relationship. I don't advocate for people to stay in any abusive relationship, but again, sometimes they simply can't leave.
Yeah, well, and the fear that I don't want to lose contact with my kids. I don't want my kids to think that I abandoned them, all sorts of issues.
And also, they don't want the abuser to abuse the child.
Right. This is true too. Yeah. So I find, again, one of my areas that I focus a lot on is OCD. And I know that's not an area for you, but when I work with OCD patients, what I have learned, and this is just sort of my way of practicing, many of them may have unresolved trauma. Not that it causes the OCD, but it's just a co-occurring disorder. There happened to be something else in their life that was traumatic. And if I have a patient who has not resolved that underlying trauma, I find it's very difficult for them to do the type of therapy we do when we do OCD, the exposure and response prevention and other things. And so I often will use EMDR to address the trauma. And it's amazing to watch the results. And once we clear out the trauma, then and only then do we go and start working with the OCD. And if I tried to do OCD treatment and leave trauma untouched and untreated, we're not going to go anywhere because they're stuck.
But do you not find, Andrew, that OCD really is a manifestation of severe trauma and stress?
There are some, I always tell people that in my practice, I see two types of OCD patients. I see one is the person who will say, ever since I was a kid, I've had OCD thoughts or whatever. And the second one is the one who says, I had this traumatic thing happen, and then I have OCD. And so I see like false memory OCD come out of traumatic experiences. I see harm OCD. I see a lot of things come from that. Now, I don't know that the trauma is causing it or not, but there's definitely the correlation that I see.
Okay. So you do see that. Yes, that's okay, because I've seen a lot of that too with severe anxiety.
Mm-hmm. Is
usually a manifestation of severe trauma. Anyway.
Yeah, no, that it's a great question, because I was actually just talking to I train a lot of interns and residents, and obviously since I like the area of anxiety and OCD, we talk about it. And I was just talking about a case last night where a client had a lot of trauma going on, and as a result developed these obsessive behaviors. But the resident was asking me, is that OCD? And I asked some more questions, and in my determination, based on what he was telling me, it wasn't OCD. It was an anxiety response to trauma. But it was, I had to explain to him why it was different from OCD. And rather than get all the technical details, it's an important discussion to be had when you're trying to figure out, diagnose what's going on, so you know how to even address it.
Exactly. And I'm sure you've had a lot of success too with your clients, Andrew. And I guess I think that the most challenging people I've ever tried to help were victims of severe and even vicarious trauma, because that's just inculcated generationally. It's just vicarious with parents and children, and it's almost like they have a phantom following them.
Mm-hmm. One that I saw a lot from COVID time that was really challenging was my client would end up being a family member of, in certain cases I'm thinking of postpartum OCD,
Okay.
where a mother has a child during COVID, and obviously motherly as well as father, paternal instincts kick in. You want to protect your child. There's a huge fear that I don't want them to catch COVID. But what I saw in a couple cases was the mother would have postpartum OCD related to this with very poor awareness of it, and would go far, 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 far beyond the extreme of protecting the child to the point that the child could never go outside, could never socialize with other people, couldn't even socialize with the father or grandparents, couldn't have any exposures to anything. And it caused major family strife. And what happened, my concern was always, the kids' development. They're not socializing with anybody. They're not getting any exposure. And just recently, one of them, the mother allowed the child to go to preschool. And the child prior to that for years had been basically locked in the house. So imagine when the child goes to preschool around all these other kids, and what normally happens when you go to preschool, the kids pick up everything that all the other kids have. Well, this particular child was never exposed to anything, so built up no, resistance. So the child got everything.
Oh, wow.
So, these are unintended consequences. Here's a parent who's, the thought is, I'm going to protect my child from COVID because I don't want my child to get COVID. But the unintended consequence was I harmed my child in a way because I didn't let them build up any resistance. Not to mention the social factors.
Right, exactly. And they're not socialized.
Yep.
Okay, so then that also segues into a lot of different specific issues, Andrews. Without socialization, then they're misdiagnosed as autistic, etc. There's all kinds of problems with that malassociation.
Yeah.
Exactly.
These are, it's sad and it's hard, but on the other side, I'm glad that people are seeking treatment, because at least we can try and start dealing with some of this rather than let it continue. But it's really hard, and I mean, on one level, you can't blame a parent for wanting to protect their child. But again, like we were talking before, you got to treat the whole client. You got to see the whole picture. You can't protect from one thing without having an impact on other things, but that's forgotten sometimes. So,
Okay, yeah, I agree. But then where's the delineation of smothering and suffocate? And theirs are going to cause the anxiety, the suffocation, the anxiety, and even asthma. I'm talking real suffocation like that, Andrew. I'm sure you've seen that.
Yeah, oh no, I'm on the same page as you. I'm just saying that, in order to start off with treatment, I'm, trying to understand where the patient is coming from. What are their thoughts that got them to where they are, so that then you can then start from where they are to then kind of get to where they want to be. But that's, that's just part of the practice. But, and you see that in OCD all the time, where people are trying to do one thing the right way, or to protect themselves, or to be perfect. And what they end up doing is causing the very harm that they're trying to prevent against. So, for example, if you've got someone who wants to make sure that everything is super, super clean all the time, and they want to use antibacterial wipes and antibacterial soap and wash everything constantly. Again, they put themselves in a place where they're getting no exposure and building up no resistance to anything. So now the desire to keep away all the bacteria is actually causing the harm that they're afraid of, which is getting sick from bacteria.
Right. They have they don't have a developed immune system.
Yeah.
Like a psychological immune system.
It's really, it's a very challenging area, because the person's, the thought is, I want to protect myself, but it's hard for them to understand you're actually doing the opposite. Right. Because it doesn't register sometimes. So this is one of the reasons why I enjoy working with OCD, because helping people through that type of a thought process.
That is very rewarding. I'm sure you've had a lot of success.
It's great. I mean, there's some treatment resistant cases out there, but luckily a majority of them are make good progress. So that's rewarding. So, you know, there's a lot here, obviously, that we both have had some experience, excuse me, some experience with, but I don't want to miss talking about the work that you do with EAP and relocation and anxiety related to that. Can you fill us in on some of that work?
Oh, sure, of course. Personally, I'm a wanderer, I'm a drifter, I'm a nomadic, virtual nomad. But I can understand that a lot of people really are, they're anchored to their families and their home, and that's okay. And so for them, they've lived in the same place all their lives, and maybe they take a vacation to Maui every other year or something. But they have an anchor, they have a home, they have stability and a foundation. And these are people who, say, for example, they have some kind, they have some kind of a relocation demand, and they have to maneuver their entire family and their children. That means their kids have to go to different schools, find new friends. That's very difficult for children to integrate like that. And then people, they've been on the same bowling team all their lives. It's very difficult for them. These are people who they have Sunday, they go to church on Sunday, and then they have Sunday brunch with their friends and family. What are they going to do in a different town, a different city that's far from home? Or they move to a different country, they don't speak the language. There's a big language barrier. Not everybody learns languages that easily, Andrew. It doesn't work that way.
Right.
And then, of course, you're the token American. In some countries, you're public enemy numero uno. You can't just go there. So they don't know how, they really have no idea. And some of them just aren't interested in making friends outside of who they know. So it's almost a psychological impossibility to try to convince them. You can't convince them it's going to be okay. You don't know that, but you can. What I do is the first thing I ask them is, what are your interests? Let's see about your interests. Now you can find things online. It isn't like before you go to look through the yellow pages and ask people. So now it's a different situation. You look online, you can find a bowling league, you can find an AA meeting, you can find anything you want. But for me, I'm working with people, and I'm extremely sensitive to cultures. And I'm working with people who, they just need to know they have to be safe. They don't feel safe. People, we all need to feel safe. And anxiety is unsafe. So where do they feel safe? What's the biggest factor? What are they going to do? Well, for some people, the first thing they do is they find a church. That's a good thing, or a temple or something, a synagogue. Or they find some place where they can at least tiptoe into integration. So that's the first thing I do, is ask them, where would you feel the safest? Where do you feel safe now? You feel safe at home. What would feel like home to you in a city 3,000 miles away? And some of them aren't even metropolitan cities. That's even more terrifying, because you're skydiving down on a town of maybe sometimes a couple of thousand people, and that's even worse, because you're literally encroaching on territory of people who've lived there all their lives. They're not going to leave, and they don't know who you are. That's even worse. You're like an alien.
Yeah.
Kids, that's even harder for the kids. So the first thing is for them to try to make friends through the families of their kids. So that's helpful. So that's how I work with them. Also, cognitive behavioral therapy is really my forte. That's my expertise. I give everybody assignments. Everybody does assignments, written assignments. That's the best thing for people to do, is to what I call to cognitize something. And that's very helpful. And accountability. So with my stay in close contact with my clients, so I contact them during the week to ask how they're doing and if they need anything. So just make sure they're okay. And especially sometimes it doesn't have to be okay, or something that you can understand. A lot of people, they'll just never understand something, but it's not necessarily, you don't necessarily need to understand Mandarin Chinese. It's just an acceptance factor that people speak the language. You don't have to understand it. You just have to accept it. And just accepting things, and you've already established 98% of the fact that 90% of the fact that you're okay with the issue and it's not a problem anymore. It's really just an acceptance factor in most of these situations.
Right. Well, I like what you said about, so, you've got some people that are relocating who have kids. And, I like the fact that you said that, through the kids and the families of the friends that they make at school and so on and so forth, there's a way to start to build your own sort of network of other people, which makes a lot of sense, because if your kids are going to be playing with their kids or hanging out, that makes sense. What about people who don't have kids and are not comfortable just looking for that bowling league or that church or whatever it may be? How do you work with them to get comfortable?
Okay, well then that's a different situation, Andrew, because then are they going to present as intractable like that? And then how are they going to manage their anxiety in a new city, in a new town, where they refuse to establish any kind of connections? Now that's about them. And why won't they do that? What's their biggest fear? And if it's not a fear, and if they're just so adamant that no, well, I just don't want to leave my family or this, well, maybe then at that point, maybe they shouldn't leave, or they should start looking for another job. Because if that's the case, then maybe that's what they should do. Some people just can't integrate, they refuse. And especially if there's issues behind that, some personality disorders or some severe trauma or something. You can't just annihilate somebody like that and then kick them out of a city where they've grown up all their life, in a town, in the same house. Some people have lived in the same house all their lives.
Right.
Yeah.
So do these people, I'm assuming, and I don't know, so fill me in, but I'm assuming some of these folks are working for an organization, a company. The company says, we want to relocate you. They then come to EAP because they're starting to feel this anxiety related to this decision point. Do some of them not want to go, or are they excited about going and they're just confused?
No, some of them don't want to go at all. I mean, they are adamant. And if that's the case, then they need that to present that to the attention of, say, human resources, because mostly human resources, they're very reasonable these days. And a lot of them are just, they don't want any problems, Andrew. They don't want any legal conundrums. So they don't want any lawsuits. And so they don't want any, a hostile work environment or something that's going to compromise somebody's emotional security. And it's just easier to find at that point, it's easier to find somebody who wants to go, if they can find somebody who has the same abilities.
Right.
But again, if somebody's adaptable and amenable, then it's easy to work with them. But if somebody is just intractable like that, it's like trying to teach somebody a new language. If you're not going to learn it, then you're not going to learn it.
Right.
People just can't dance. They have no rhythm.
Yeah.
That's okay. Some people can't dance. It's like some people, they can't read. That's okay too. We all have different abilities.
Well, are there any particular tips or anything that, let's say an individual is being asked to relocate by their company, and the individual wants to relocate or thinks it might be a great idea, but they have a family at home and their spouse or the kids or whatever definitely do not want to relocate. What kind of tips do you have to help them kind of figure out what to do?
Okay. So this is all depending. So let's say, for example, okay, they're excited about the prospect, but they just don't know how to go about it. They've never lived anywhere. Maybe they've traveled, but they've never lived anywhere but where they've lived. So at that point, I would ask them, well, what are your interests and what feels safe for you to start with? Some maybe going to church once a week, finding a church. here again, maybe finding a sewing circle or something like that. There's meetup groups. There's lots of meetup groups. So you could start with that. There's also internations. Internations is worldwide. So it's a global arena where you can anywhere you go in the world, you can find connections. So yeah. So there's places like, and then learning a language. So I would also advocate for them to learn the local language if they're going somewhere overseas.
Right.
That's always a wonderful way to integrate, literally, when you speak somebody's language. So at least it's a start. And I would advocate for them to start at least initiating something where they can start meeting people at least, so that they're not so isolated, or even join a book club.
Yeah. Well, so internations, I had not heard of that before. Is that like Meetup or something?
It's not really like Meetup so much as that it's a global platform. They with branches in all over the world. So wherever you go, they have a lot of online activities. They also have a lot of in-person activities. So you can meet them at a museum. And also what you could do is places like TripAdvisor and even Airbnb. They have activities and experiences.
Oh, I
Yeah,
didn't
so I
know
tell them about that. So look for that. Look for something to do. You can go to the zoo with them. You could go to a museum with them in a group. So at least you're in a group. You're not alone.
that. Right.
I
Right.
mean, even if you don't meet your best friend that day, at least you're not alone. You're integrating.
Yeah. No, that sounds like a good idea, because if you're trying to get yourself introduced to a new community and all by doing group type of activities, you now have a good number of people that you're meeting all at the same time. And typically you'll find that you click more with, certain ones than others, and that's okay.
That's right. Yeah, absolutely.
And so you stay in touch with these folks as they kind of get themselves integrated?
I stay in touch with my clients a lot. Definitely I do. Make sure that they're okay, they're integrated, then they graduate and they spread their wings and they take off.
Well, and I realize that everyone works at their own pace, but do you find sort of on average how long it takes someone to become comfortable in a new situation like that?
Usually it takes less than a year. Usually less than a year. I mean, if there's some reason they really can't leave where they are, sometimes people are taking care of elderly parents or a disabled child. They can't leave like that. So that's a different issue, Andrew. If that's the point, then they really can't leave.
Right.
When they do, it's usually less than a year that they're really able to integrate. They start to feel comfortable and they're okay with where they are. And they know they can always go back home.
Right. Except now they'll know a second language as well, probably just out of necessity.
Yeah, it is. And it's extremely valuable. Extremely.
Wow. That's wonderful. Well, this is, you certainly have a very broad career, and you've learned a lot of very interesting things and worked in some interesting areas. Some things that I just have never really thought about working with. It just hasn't even come across my mind because I found my little niche here. So, but it is really interesting to learn about it and to learn how you're working with it.
Thank you. Thank you. I appreciate it. Well, you've done a lot in your career too. And I'm sure you'll expand and extrapolate on it.
Yeah, we all find the things that we're interested in, and that takes us down that road to do more in that area. And I was sharing with you before, I started off as an attorney, and after a while I realized that there was something different that was more interesting to me, and it was mental health and just understanding the human mind. And that got me into where I'm at now with anxiety, OCD, and related disorders. I find it interesting to watch how people, how things come about, understanding what's going on in the brain, understanding people's reactions, understanding opportunities to, help them make the changes they want to make. And that can be really rewarding. So that's what keeps me doing what I'm doing.
Yeah.
So, well, I really want to thank you for taking the time out of your schedule to join us today and share your experiences and how you do the work that you do. And if somebody wanted to get in touch with you, do you have a website or some way for them to contact you?
I work for Spring Health. And so you could find me on springhealth.com.
Okay, perfect. Great.
Yeah, thank you. Thank you, Andrew.
Well, thank you.
And all the best of luck to you. And again, check out that school.
Great. Well, thank you so much.
Okay, thanks, Andrew. Take good care.
All right.